Degradation of amino acids involves removal of alpha amino groups, followed by breakdown of the resulting carbon skeletons. These pathways converge to form 7 intermediate products. These products directly enter the pathways of intermediary metabolism, resulting in the synthesis of glucose or lipid, or in the production of energy through the citric acid cycle. Today, we will focus on 4 pathways. First, we will look at amino acids that form succinyl-CoA. 4 amino acids form succinyl-CoA. They are isoleucine, methionine, threonine, and valine. Here, from alpha-ketobutyrate to propynyl-CoA and to succinyl-CoA. This represents the first pathway in this lecture. Isoleucine and valine enter this pathway at propynyl-CoA. Methionine and threonine enter this pathway at alpha-ketobutyrate. To help you remember these amino acids, I have created a mnemonic. I saw MTV. I represent isoleucine, M represent methionine, T for threonine, and V for valine. First, let's look at metabolism of methionine. Methionine can be converted to homocysteine and then to cysteine. On the other hand, methionine can also be synthesized from homocysteine. Here, we will take a closer look at this pathway. Methionine is converted to S-adenosyl methionine, or SAM. SAM is a methyl donor. After methyl group is transferred to a methyl acceptor, SAM is converted to S-adenosyl homocysteine. After adenosine is removed, this compound is converted to homocysteine. There are 2 ways to metabolize homocysteine. One way is converted to cysteine. Second way to dispose homocysteine is converted back to methionine. Both pathways are significant. First, conversion of homocysteine to cysteine takes 2 steps. In the first step, homocysteine and serine condensed to form cystathionine. In the second step, cystathionine is cleaved to form cysteine and alpha-ketobutyrate with release of ammonia. These 2 steps are reversible depending on the concentration of reactants. These 2 reactions require PLP, the active form of vitamin B6. Second, conversion of homocysteine to methionine is catalyzed by methionine synthase. It requires vitamin B12 and folic acid. Folic acid provides the methyl group. This reaction recycled N5 methyl tetrahydrofolic acid to tetrahydrofolic acid. Tetrahydrofolic acid can then be used for biosynthesis of other compounds. Metabolism of methionine can be summarized in 5 compounds. one methyl donor, SAM, one intermediate, homocysteine, and 3 vitamins, vitamin B6, B12, and folic acid. This is S-adenosyl methionine, or SAM. This part comes from adenosine, and this part is derived from methionine. Notable reactions that require SAM include cytosine methylation. This has been covered in the lecture Regulation of Gene Expression. Synthesis of creatine from arginine and glycine. This will be covered in the lecture Conversion of amino acid to specialized products. Synthesis of epinephrine through dopamine pathway. And synthesis of melatonin through serotonin pathway. Homocysteine is toxic. Here is a clinical correlation. Homocysteine urea is characterized by buildup of homocysteine in the blood and in the urine. It is caused by a deficiency of cystathionine beta synthase. Symptoms include lens dislocation after age 3, osteoporosis, and mental retardation. It also causes atheromas. The active form of vitamin B6 is PRP. It is required for transamination, decarboxylation, and reactions that involve a thiol group. Vitamin B12 is required for recycle of tetrahydrofolic acid. Vitamin B12 deficiency causes macrocytic anemia. Folic acid is required for biosynthesis of many compounds, including nucleotides. Folic acid deficiency causes spina bifida. In addition to homocysteine that builds up due to deficiency of cystathionine beta synthase, other chemicals may build up in diseases in the methionine pathway. Cystathionine buildup due to deficiency of cystathionase or cystathionine gamma lyase. Propionic acid buildup due to deficiency of propionyl-CoA carboxylase. Methyl-malonic acid buildup due to deficiency of methyl-malonyl-CoA mutase. Threonine is dehydrated to alpha-ketobutyrate, which is converted to propionyl-CoA and finally to succinyl-CoA. Amino group is removed through deamination catalyzed by threonine dehydratase. This enzyme requires PRP as a coenzyme. Threonine is one of the 3 amino acids that do not participate in transamination for removal of the alpha amino group. The other 2 amino acids are methionine and histidine. Here are 3 pathways to degrade valine, isoleucine, and leucine. The first 3 steps are common in these 3 pathways. They are transamination, oxidative decarboxylation, and FAD-linked dehydrogenation. Transamination requires PRP as coenzyme. Oxidative decarboxylation requires 5 coenzymes as described in mnemonic, Tender Loving Care for Nancy. FAD-linked dehydrogenation requires FAD. Here, transamination is catalyzed by one of the 3 transaminases. They use alpha-ketoglutarate to accept the amino group. They require PRP as coenzyme. Oxidative decarboxylation is catalyzed by branch chains alpha-keto acid dehydrogenase. This enzyme requires 5 coenzymes. Deficiency of this enzyme leads to maple syrup urine disease. The key feature of the disease is presence of sweet-smelling urine, similar to maple syrup. FAD-linked dehydrogenation is very similar to the first step in beta oxidation. Here is integration. Branch chains alpha-keto acid dehydrogenase requires 5 coenzymes as described in the mnemonic Tender Loving Care for Nancy. It is comprised of 3 enzymes, E1, E2, and E3. E1 is comprised of 2 subunits, E1 alpha and E1 beta. The E3 subunit is also a component of pyruvate dehydrogenase complex and alpha-ketoglutarate dehydrogenase complex. FAD-linked dehydrogenation is similar to first step in beta oxidation, catalyzed by acyl-CoA dehydrogenase. Now, let's move to part 2. We will look at amino acids that form fumarate. This is fumarate. We will focus on 2 amino acids, phenylalanine and tyrosine. Phenylalanine is first converted to tyrosine and finally to fumarate and acetoacetate. In this pathway, one key enzyme is phenylalanine hydroxylase. It converts phenylalanine to tyrosine in the first step. It requires a unique coenzyme, BH4. A deficiency of this enzyme causes phenylketonuria. In this pathway, there are 2 significant coenzymes, BH4 and PLP. 4 diseases associated with this pathway are PKU, alkaptouria, tyrosinemia, and albinism. PLP is a coenzyme for tyrosine aminotransferase that catalyzes transamination in the second step. H-hydrobiopterin, or BH4, is a coenzyme for 3 enzymes. They are phenylalanine hydroxylase, tyrosine hydroxylase, and tryptophan hydroxylase. Deficiency of BH4 blocks phenylalanine to tyrosine conversion, causing PKU, and reduce synthesis of dopa and serotonin. BH4 is derived from GTP. Synthesis of BH4 requires 2 key enzymes. They are dihydrobiopterin synthetase and dihydrobiopterin reductase. A deficiency of either enzyme leads to BH4 deficiency. In addition to PKU, which is caused by a deficiency of phenylalanine hydroxylase, there are 3 other diseases associated with this pathway. Alkaptouria is caused by a deficiency of homogentisate oxidase. Tyrosinemia is caused by a deficiency of fumaryl acetoacetate hydrolase. Albinism is caused by a deficiency of tyrosinase. Patients with alkaptouria have homogentic acid urea. Here is the normal urine, and here is the urine from a patient. The patient's urine contains elevated levels of homogentic acid, which is oxidized to dark pigment on staining. Patients have large joint arthritis and black oculonotic pigmentation of cartilage and collagenous tissue, as shown in this picture. Patients with thalassemia have characteristic cabbage-like water to the skin or the urine, along with liver failure and renal tubular acidosis. Patients with oculocutaneous albinism have total absence of pigment from hair, eyes, and skin, along with vision defects and photophobia. Patients with PKU have seizures, hypopigmentation, and a musty odor to the baby's sweat and urine. The musty odor is due to buildup of metabolites of phenylalanine, especially phenyl acetate. Untreated PKU can lead to intellectual disability, behavior problems, and mental disorders. A baby born to a mother with maternal PKU may have heart problems, a small head, and low birth weight. PKU is caused by a deficiency in either phenylalanine hydroxylase, dihydrobiopterin synthetase, or dihydrobiopterin reductase. Next, we will further look at intellectual disability and maternal PKU. Phenylalanine is a large neutral amino acid. Large neutral amino acids compete for transport across the blood-brain barrier through the large neutral amino acid transporter. If phenylalanine is in excess in the blood, it will saturate the transporter. Excessive levels of phenylalanine tend to decrease the level of other large neutral amino acids in the brain, such as tryptophan and tyrosine. As these amino acids are necessary for proteins and neurotransmitter synthesis, phenylalanine buildup hinders the development of the brain, causing intellectual disability. Patients with PKU should be treated with diet restriction. Their diet should contain low phenylalanine or phenylalanine-containing products, such as sweeteners. Women with PKU not on a low phenylalanine diet have offspring with maternal PKU syndrome. High blood levels of phenylalanine in the mother cause microcephaly and mental retardation, congenital heart abnormality in fetus. Fetal effects may manifest during first few months of pregnancy. As a result, dietary control of blood phenylalanine levels in the mother must begin before conception. Now, let's move to part 3. We will look at amino acids that form pyruvate. This is pyruvate. 5 amino acids can form pyruvate. They are alanine, serine, and cysteine, with 2 additional amino acids, glycine and tryptophan. Degradation of tryptophan takes 13 steps. First 8 steps takes place in the cytoplasm and the rest inside mitochondria. The first step breaks the first ring. The second step removes the aldehyde group. The result is quinoranine. Third step is hydroxylation at position 3. In step 4, alanine is removed. In step 5, the benzene ring is broken. The result is 2-amino 3-carboxymuconate 6-semialdehyde, or ACS. In step 6, carboxyl group is removed by a decarboxylase. In step 7, aldehyde group is oxidized. In step 8, amino group is removed by transamination. The result is alpha-ketoadipate with 6 carbons. These 2 carbons correspond to 2 carbons in tryptophan, and these 2 carbons correspond to the other 2 carbons in tryptophan. Inside mitochondria, carboxyl group is removed through oxidative decarboxylation by alpha-ketoglutarate dehydrogenase. The result is glutaryl-CoA. Terminal carboxylic group is removed through oxidative decarboxylation by glutaryl-CoA dehydrogenase. Finally, hydroxylation and oxidation give rise to acetyl-acetyl-CoA. Alternative products from tryptophan include niacin, serotonin, and melatonin. Niacin is a component of vitamin B3. It is synthesized from tryptophan through kynurenine and ACS pathway. Serotonin is a neurotransmitter. It is synthesized from tryptophan through hydroxylation followed by decarboxylation. Melatonin is a hormone produced by pineal gland. It regulates sleep-wake cycle. It is synthesized from serotonin through acetylation followed by methylation using SAM as the methyl donor. There are 3 ways to degrade glycine. First, glycine can be converted to serine by addition of hydroxymethyl group provided by N5N10 methylene tetrahydrofolic acid. Second, glycine can be decarboxylated and methyl group transferred to tetrahydrofolic acid, giving rise to N5N10 methylene tetrahydrofolic acid with release of ammonium. Third, glycine can be deaminated by diamino acid oxidase, giving rise to glyoxylate, which is oxidized to oxalate. Excess oxalate can form kidney stones. To prevent the buildup of glyoxylate, alanine glyoxylate aminotransferase converts glyoxylate to glycine. Here, 3 enzymes: serine hydroxymethyltransferase, glycine cleavage complex, and alanine glyoxylate aminotransferase all require PLP as a coenzyme. In addition, glycine cleavage complex also requires FAD and lipoic acid. 2 diseases are associated with glycine metabolism. First one is oxaluria type 1. It is caused by a deficiency of alanine glyoxylate aminotransferase. Oxalate, in the presence of calcium, will precipitate and form kidney stones. Second disease is non-ketogenic hyperglycemia. It is caused by a deficiency of glycine cleavage complex. Patients with this condition have severe mental deficiency and low survival rate during infancy. High glycine concentration is found in all tissues, including blood and CNS. There are several ways to degrade cysteine. Here is a non-oxidative pathway. It takes 2 steps. First step involves transamination, and second step involves release of hydrogen sulfide. There are 3 ways to degrade serine. First way is through deamination catalyzed by serine dehydratase. Second way is to convert serine to glycine by serine hydroxymethyltransferase, as described earlier. The third way is to convert serine to cysteine using gamma cystothionase. All three enzymes require PLP as a coenzyme. Glucogenic amino acids enter the TCA cycle through 5 entry points. So far, we have covered 3 of them: succinyl-CoA, fumarate, and pyruvate. The rest 2 entry points are oxaloacetate and alpha-ketoglutarate. Aspartate can be converted to oxaloacetate through transamination catalyzed by AST. Asparagine can be converted to aspartate by asparaginase. Glutamate can be converted to alpha-ketoglutarate through oxidative deamination catalyzed by glutamate dehydrogenase. Glutamine can be converted to glutamate by glutaminase. Histidine is first deaminated by histidase, then to glutamate through N-formimino-glutamate or pheGlu. Proline and arginine are converted to glutamate through a common intermediate, glutamic semialdehyde. Now, let's move to part 4. We will look at amino acids that form acetyl-CoA. This is the acetyl-CoA. 4 amino acids can form acetyl-CoA. Among them, 2 can form acetyl-CoA directly. They are leucine and isoleucine. 2 additional amino acids can form acetyl-CoA through acetyl-acetyl-CoA. These amino acids are lysine and tryptophan. Leucine and isoleucine give rise to acetyl-CoA directly without forming acetyl-acetyl-CoA. Leucine form an intermediate, HMG-CoA. Isoleucine form an intermediate, 2-methyl-acetyl-acetyl-CoA. As we discussed earlier, these 2 amino acids have clinical correlation, which is maple syrup urine disease. Lysine and tryptophan form acetyl-acetyl-CoA before forming acetyl-CoA. Lysine degradation follows saccharopin pathway. Tryptophan degradation follows kynurenine pathways, as described earlier. Phenylalanine and tyrosine give rise to acetoacetate as well as fumarate. They are both ketogenic and glucogenic amino acids. Altogether, there are a total of 6 ketogenic amino acids: leucine, isoleucine, lysine, tryptophan, phenylalanine, and tyrosine.